Stop everything you are doing right now. What I am about to tell you could put hundreds, even thousands of dollars back into your pocket, money that has been quietly, illegally taken from you, possibly for years. If you are a senior, or if you love someone who is, you need to hear every single word of this, because what is happening to millions of older Americans right now is not just unfair. It is against the law, and the people doing it are counting on you not knowing. Right now, as you watch this, nursing homes, insurance companies, banks, debt collectors, and even some hospitals are charging fees to seniors that are completely 100% illegal under federal and state law in 2026. Not questionable, not in a gray area, illegal. And yet, millions of seniors are paying these fees every single month without question because nobody told them they didn't have to. Well, today, that changes. Today, you find out exactly what those fees are, whether you qualify to get that money back, and what steps you need to take starting today to stop it. It is being charged to Medicare beneficiaries across the country, and it is so common that most seniors assume it is normal. It is not. Many medical providers, particularly outpatient clinics and hospital systems, are charging seniors what is called a facility fee on top of their normal Medicare co-payments. These are fees that appear on your medical bill as administrative charges, processing fees, or even room and resource charges. Here's the truth. Under the Medicare rules updated and reinforced in 2026, certain categories of facility fees charged without proper prior disclosure are not legally collectible from Medicare beneficiaries. If you have been paying these and were not given clear written notice before your appointment about what you would owe and why, you may have a legal right to dispute every single dollar. The second illegal fee is happening inside nursing homes and long-term care facilities, and it is targeting some of the most vulnerable seniors in this country. Federal law under the Nursing Home Reform Act, enforced and updated through CMS regulations, explicitly prohibits nursing homes that accept Medicare or Medicaid from charging residents and their families certain add-on fees for basic care services. This includes charges for things like assistance with bathing, dressing, mobility help, and basic medical monitoring. These are services that are already covered under the facility's Medicare or Medicaid reimbursement, and yet thousands of facilities are itemizing these services and billing families separately, knowing that most families are too worried, too exhausted, or too afraid to push back. If you or someone you love is in a care facility right now, pull out that bill. Look at it carefully. Any charge for basic daily care assistance that is already covered by Medicare or Medicaid is potentially illegal, and you can file a formal complaint with your state long-term care ombudsman to investigate and recover those funds. The third illegal fee involves bank account maintenance charges and low balance penalties being applied to seniors enrolled in certain government benefit programs. Under updated federal banking protection guidelines, effective in 2026, financial institutions that offer accounts specifically marketed to seniors, or that primarily serve beneficiaries of Social Security, SSI, and VA benefits are restricted from charging maintenance fees that effectively consume or reduce those benefit deposits below minimum livable thresholds. This has been interpreted and enforced more aggressively this year, and several major financial institutions have already faced regulatory action. If you are a senior living on Social Security and your bank has been quietly deducting monthly maintenance fees, account service fees, or minimum balance penalties from your account, you need to contact your bank in writing and demand a fee review. In many cases, simply requesting a senior exemption or a benefits-based account reclassification can stop these charges immediately, and in some cases, trigger a refund. The fourth illegal fee is being charged by debt collectors, and this one is particularly cruel because it targets seniors who are already under financial stress. Under the Fair Debt Collection Practices Act, which saw renewed enforcement guidance from the Consumer Financial Protection Bureau in 2026, debt collectors are prohibited from adding collection fees, interest charges, or administrative processing costs to a debt unless those charges are explicitly authorized by the original debt agreement or specifically permitted by state law. This sounds technical, but here is what it means in plain language. If a debt collector is calling you or sending you bills that include fees tacked on top of the original debt amount, fees for sending letters, fees for account management, fees for so-called legal processing, those may be completely illegal additions. Seniors are disproportionately targeted by these tactics because collectors assume that older people will not fight back. You can fight back. You can send a written debt validation letter demanding an itemized breakdown of every charge. And if those charges are not legally supported, you can report the collector to the CFPB and your state attorney general's office. Under federal rules that were clarified and strengthened going into 2026, Medicare Advantage plans are prohibited from charging cost-sharing amounts that exceed what traditional Medicare would charge for the same services in specific circumstances, particularly for dual-eligible beneficiaries, those who qualify for both Medicare and Medicaid. If you are in a Medicare Advantage plan and you are also receiving Medicaid benefits and you have been charged co-payments, co-insurance amounts, or deductibles for covered services, there is a very real possibility that some or all of those charges were illegal. The rules protecting dual-eligible seniors are among the strongest in federal health law, and they are among the most commonly violated. Contact your state health insurance assistance program, known as SHIP, for free counseling and a review of your billing history. This is a free service available to every senior in America, and it exists precisely for situations like this. The sixth illegal fee is one that is growing rapidly as more seniors move into assisted living communities and continuing care retirement communities. Many of these facilities are adding what they call community fees, lifestyle fees, or amenity access charges at move-in or on an ongoing basis. Here is where the law steps in. In a growing number of states, regulations updated in 2025 and 2026 explicitly require that any non-refundable upfront fee charged to a senior entering a care community must be clearly disclosed in a standardized contract, and certain categories of ongoing fees are either capped or prohibited entirely for residents receiving state-funded long-term care assistance. If you or a loved one signed a contract for an assisted living facility and paid a large upfront fee, or has been paying monthly charges for services that were originally described as included, it is time to revisit that contract with a legal aid attorney. Many areas have free legal services specifically for seniors, and they can review your agreement and tell you whether any of those fees cross the legal line. Prescription drug plan members who are seniors enrolled in Medicare Part D have federal protections against certain out-of-pocket charges at the pharmacy. In 2026, the Inflation Reduction Act's drug pricing provisions have fully phased in significant caps and protections, including the new annual out-of-pocket cap for Medicare Part D enrollees. This means that after a senior has paid a certain amount in covered drug costs within a calendar year, their cost sharing should drop to zero for the rest of the year. Yet pharmacies, in some cases operating on outdated billing systems or simply failing to apply plan adjustments correctly, are continuing to charge seniors full co-payment amounts even after they have crossed the out-of-pocket threshold. If you are taking multiple medications and you have been paying co-pays at the pharmacy month after month without any change, even later in the year, you need to call your Part D plan administrator immediately and ask for a full accounting of your out-of-pocket spending for this calendar year. If you have crossed the threshold and are still being charged, every dollar you paid after that point is potentially a billing error, and you are entitled to a refund. Now let me tell you who qualifies for recovery and action on these fees, because this is not just for one type of senior. This applies to you if you are 65 or older and enrolled in any part of Medicare. It applies if you receive Social Security retirement benefits, disability benefits, or SSI. It applies if you are in a care facility of any kind, whether that is assisted living, a nursing home, or a memory care unit. It applies if you have a Medicare Advantage plan, a Medigap supplement policy, or a Part D prescription drug plan. And it applies if you have ever been contacted by a debt collector or had fees deducted from a bank account linked to your federal benefit payments. In short, if you are a senior living in America in 2026 At least one of these 7 illegal fees has likely touched your life, possibly more than one. And the total amount being taken from seniors across this country through these practices is staggering. We are talking about billions of dollars that should still be in your wallet, in your savings account, or in your family's future. First, gather your recent bills, medical bills, pharmacy receipts, nursing home statements, bank statements, and any letters from debt collectors. Go through them line by line and look for any of the charges we discussed today. Second, write everything down. Document the amounts, the dates, and the names of the providers or institutions that charged you. Third, contact the appropriate agency for each type of violation. For Medicare billing issues, call 1-800-MEDICARE. For nursing home complaints, contact your state long-term care ombudsman. For banking fee issues, contact the Consumer Financial Protection Bureau at consumerfinance.gov. For debt collector violations, file a complaint with the CFPB and your state attorney general. For Part D drug coverage issues, call your plan directly and ask for a benefits coordinator. And fourth, this is the most important step of all, do not be silent. Do not assume that these charges are correct just because a bill says so. Do not assume that a big institution would not make a mistake or would not deliberately overcharge you. You have rights, powerful, federally protected rights, and you deserve to have every single one of them honored. What we have covered today is just the beginning. The laws protecting seniors in this country are changing and expanding every single year, and there are millions of dollars in benefits, protections, and refunds that seniors are leaving on the table simply because they do not have the information they need in time. That is exactly why this channel exists. Every single week, we bring you the latest updates on senior financial rights, government benefit changes, healthcare protections, and the news that affects your life and your money directly. We do not use complicated language. We do not bury the important stuff. We tell you exactly what you need to know, when you need to know it, in plain language that anyone can understand and act on. If today's information helped you, if it opened your eyes to something you did not know before, then do not let this be the last time. Hit that subscribe button right now and turn on your notifications so that you never miss a single update. Because the next video we release could be about a benefit you are missing, a deadline you need to meet, or a protection you did not know you had. This community is growing every day because seniors across America are tired of being the last to find out and the first to be taken advantage of. Join us. Share this with someone you love. And remember, knowledge is not just power. For seniors in America today, knowledge is money.